Alright, so Dr. Loberg here, and I just wanted to review a couple of things. You've had an implant placed today, and I wanted to review 5 of the top 5 questions that we always get called in and asked to the front office. So the first one is when am I going to get my tooth? So the trick is you had an implant placed, which is a piece of titanium that's set underneath the gum, and the bone literally has to grow around that root and fuse. Once that healing process is completed, typically it takes anywhere from 8 to 12 weeks to be finished. At that point, we'll then start fabricating your brand new tooth. And that's a 2-visit appointment, typically 2 weeks apart. So typically in 12 to 14 weeks after your implant, you'll have a brand new tooth that you can chew and eat comfortably on. Second question is how long is it going to hurt? We have patients that range in all different scales. Some patients have 0 pain and some patients have a great amount of discomfort. And it's all based on your body and what your body, how it normally reacts to injury. All a surgery is basically the body in the inflammatory response to heal the area as fast as possible and to seal it off from any outside invader like bacteria, which are always in the mouth. So the pain normally comes from an infection. You're going to take an antibiotic for a week, 3 times a day by 7 days. Don't skip out. Don't stop at day 3. Okay. The second thing is you're going to have a pain medication that you're going to take every 4 to 6 hours, typically for the first 3 days. If you stay on top of that pain medication like a clock and mark it off on a little sheet of paper, you should be set in that regard. The third thing patients always ask is whether I'm going to get a temporary. So typically on a molar or on a back tooth, which isn't really visible, we don't usually put temporaries on immediately, especially for single implants. So the answer is no, you'll not have a temporary in the back. What happens in the front? If it's a front tooth, you'll most likely have a fixed temporary, which means that temporary will actually be on top of your implant. So the most important thing that I can please ask patients that have a front implant to be very, very, very gentle chewing directly over that site. I like to liken it as a glass slipper. Cinderella had a glass slipper, and that glass slipper is very fragile. So imagine if it dropped, it would break into a million pieces. If you bite onto a fresh implant with a temporary as if it's already been healed, you can injure not only the gums, but you can injure the healing process between the bone and the implant. So how long do you have to do that? About 8 weeks. Okay. The last thing that patients always ask us is if I don't have a permanent temporary and I have something removable, sometimes we make what we call a flipper. What I always like and encourage patients to do is to take the flipper out, make sure they clean it underneath the faucet with a toothbrush, to put it back into their mouth, and to wear it as much as possible. Number 1, that keeps the teeth stable on both sides of the space. And number 2, it also preserves the gum shape and the gum line. So if you need any adjustments at all on your temporaries, or if it feels like something is a little bit cattywampus, so to speak, or out of alignment, be sure and call. It's a quick adjustment to get everything right back into meshing up the way that it should be. That's all I have for today. Make it a great day, and we will see you at your post-op check appointment.